Hello everyone. Welcome to Swasthi Vishwa Institute's YouTube channel. My name is Meghna Deshpande and I work as a clinical psychologist at Swasthi Vishwa Institute. Our institute is a Section 8 non-profit organization started by Dr. Swati Karve with the vision of transforming individuals, organizations and communities by building competencies and capabilities in order to bring a holistic change in this world. One of our goal is to bring difference in the lives of the people who are suffering from mental health issues through empathy and trust building. Once again, a very warm welcome to all of you on our channel and wish you a very happy World Mental Health Day. So, on the occasion of World Mental Health Day, today we are going to talk about a very important topic that is the biggest concern for all our old age people and their caregivers. So, we are talking about the condition which is called as dementia. So now a lot of you must be having a question, okay, what is dementia? What does it mean? And why it is so important for us to know? So dementia is a term that encompasses lot of cognitive impairments and symptoms which hinders a person's ability to perform their daily tasks and maintain independence. Memory issues, changes in reasoning and judgment, personality shifts, language and communication difficulties are some of the indicators of this condition. A study done by National Institute of Health revealed that 7.4 million people aged 60 and above are affected by this condition. As a result, it is very crucial for us to know this condition and the early signs of this disorder. We are also going to learn some communication and behavioral techniques that can assist people who are suffering from dementia and also help us gain insight into their daily obstacles and methods to overcome them. Lastly, caregivers must also be aware of the available resources and support systems so that if their loved one is going through dementia or any other cognitive decline, then they can help them with the available resources. So, today, to talk about this topic, we have a very special guest who will be sharing more information on dementia, his experience of treating people with dementia, and also he'll be giving us guidelines so that we can help the senior citizens manage and cope with this condition. Okay, so let us welcome our today's guest speaker, Dr. Pratik Surandashe. So, Dr. Pratik has been a consultant psychiatrist with us, and he is also a co-founder of Manoragya Psychiatric Clinic in Mumbai. He holds a MD degree in psychiatry and also has a experience of more than 10 years. And he has been extensively working in the field of geriatric psychiatry along with children and adolescent mental health. So welcome to our channel, Dr. Pratik. And we are really very glad to have you on our platform. And I'm sure audience would love to hear more from you about this topic. So before we go ahead
Oh,
and talk
thank you so
about
much.
the topic, yeah. So before we just land upon what is dementia and go and discuss it, I would also request you to tell more about your practice and how you started.
Right. Um, I started my practice. Basically, I've been in private practice now for almost 5 to 6 years and been practicing psychiatry or training in psychiatry since now almost 10 years. Um, the fascination with thought processes, the fascination with mental health. Why does a person behave the way they behave? And if there are issues, then why are those issues there? And when we treat them, when we help people with these practical, solutions for their problems, magic happens. And that is my fascination with psychiatry. It was there since my undergraduate days. And I started, and I have a center here in Mumbai. And I, along with my wife, Dr. Mansi Jain, have founded this center, and we cater to diagnosis for anybody with a fully functional, healthy brain, which means so right from children till into adulthood and then even late life. That is our senior citizens. So we cater to the diagnosis of all people. And yeah, that's about my practice.
Okay, that's lovely and good to hear you are so much dedicated to this field.
Yeah,
Okay. So I'm sure audience wants to know exactly what is dementia and how does it start?
yeah, yeah. So dementia is a disease process which is gradually progressive. and it's marked by cognitive impairment in a patient where the consciousness is clear. Now, the impairment is so significant that it actually causes disruption in activities of daily living. And how we have heart failure, liver failure,
Hmm.
dementia can be considered as brain failure. So it is an organ again, which is not working properly. It's functioning, it's getting hampered. Yeah.
Right. So you just now mentioned that there are disruptions. So could you explain what kind of disruptions are there, or what are the obstacles that people face?
Yeah. So generally, when we consider dementia and cognitive impairment, the term cognitive impairment means it affects functioning of the brain like memory and learning, attention, orientation, perceptual motor functioning, executive functioning like planning, organizing, sequencing, abstraction, social cognition, and language. Now, when we are talking about dementia and the difficulties people face, I'll even tell you about the various signs and symptoms
Hmm.
of dementia to start off with. Now, as I said, that there are various components of cognition that are affected. So I'll take each component and I'll tell you about the signs and symptoms when those issues crop up in that particular component. Now, if we take into consideration memory impairment, so
Hmm.
persons with dementia will have inability to learn new information or recall previously learned information. There will be repetitive conversations because they forget and they can't keep the track of what they're saying. There will be repetitive questioning. They will forget the dates. They'll forget their appointments. They'll forget to take their medications. They might even forget that there is something cooking on the gas stove, which again can be very troublesome for them. They have inability to learn new information or recall it.
Hmm.
So they can have disorientation. They can get overwhelmed very quickly. During the COVID pandemic, we had senior citizens not even registering what the pandemic was all about, that they have to wear masks or do hand sanitization.
Hmm.
Keeping in mind, this is recent memory which is impaired. So whatever has happened in the now, today, or yesterday max, they do retain long-term memory. So wherever they were born, what was the place where they worked first, or so autobiographical information, so to say. And it is in the later advanced stages of dementia that even the long-term memory is affected. After that, when we speak about the other component, it's language. So when language is affected in dementia, the speech becomes very impoverished, meaning that they don't speak long sentences, or
Hmm.
if you ask any person with dementia how they are doing, they'll say just okay. Nothing
Hmm.
more to that. If they are in between family members, they would say, I met that person, uska naam hai na wo. Acha, okay, forget that. Give me that. What is there in front of you? So you mean a cup? No, no, whatever that is, give me that. So,
Hmm.
that's a problem. They have word finding difficulties. Sometimes even to a point where they forget names. And later in advanced stages of the disease, the speech really becomes incomprehensible sometimes.
Hmm.
After that, the other component we speak about is perceptual motor, meaning the person can see certain things but can't use them. So usually when we say a person is functioning, it has two kinds of activities of daily living. One is called instrumental activity, and the other is basic activity of daily living. So instrumental activities of daily living are like using a phone, a TV remote. If these are my female patients, then most of them were knitting, or they had some hobbies. Now, basic activities of daily living like feeding, bathing, wearing clothes, getting out of bed. So sometimes we start, an assessment, and we find that these kind of issues have cropped up, and the person is having difficulties with that. Also,
Hmm.
the person lacks insight into these impairments, meaning they might not even understand that, okay, this is something which is a problem with me. So many a times caregivers try and remind them, okay, this is how it is used, but to no avail. Another component being affected is attention. So in dementia, a person with dementia is very easily distractible.
Hmm.
Then we come to executive functioning. Now, executive functioning is impaired, and we see symptoms like a person having difficulty managing finances, right? They have to keep track of the calculations, किसको कितना दिया, किससे कितना लेना है,
Yes.
or or even having difficulties in taking or maintaining their medication regimen. So the various kinds of ailments they might be having, the physician might have prescribed them something, and they're having difficulty keeping a track of that. Doing their cooking, doing their laundry, moving around, transportation, driving, all these things become a bit difficult. Multitasking becomes a very big problem. Also,
Mm.
there is impaired decision making. So they can't decide for or against something, and this becomes an issue. Even if you ask them, what do you want to have in lunch, and they can't even decide for that, it becomes so troublesome. Now, when the decision making is impaired, they can't take financial decisions or can't invest. Senior citizens are vulnerable here, where they can be exploited or duped by people who offer lucrative investment options, but the risk and everything, the person can't consider. Then the most important aspect is social cognition. Again, a component of cognitive impairment, social cognition. Now, social cognition is a term which we use where we talk about the person's inability to recognize emotions or consider individual mental state in others. So what the person is feeling, whoever my relative is, if I'm the person with dementia, I would not understand their expressions. I would not even understand what state of mind that person is. So if that person is angry at me, if they're happy, if they're sad, I won't be able to understand if I have dementia. Also, in social cognition impairment, there is a change in personality, or rather, there's a worsening of personality. So there are times where caregivers are baffled that, okay, we knew that our father was short tempered. Right now, we would say
Mm.
that he's just gotten worse as an individual. So they feel that, okay, the dementia is not there. Probably his personality has just gotten a bit affected. There is apathy. There is sometimes very frank disinhibition, where
Mm.
senior citizens pass politically or sexually inappropriate comments. Behavior in a social scenario becomes impaired, and really, people with dementia need a lot of supervision when they are in social situations because of these things. Even if we have caretakers for our senior citizens, even they require a briefing that this
Mm.
is a person with dementia, so you should expect that the behavior might just be this way. They don't mean any harm. It's just that they can't recall or they can't regulate their behavior properly. And the last and the most important, because of which the caregiver burden, meaning the kind of stress that is there on the caregivers, is high, is now called neuropsychiatric, symptoms or behavioral and psychological symptoms of dementia. And the various emotional issues are like the commonest. What we have is anxiety. Now, a person with dementia doesn't have any idea about their cognitive impairment. They might not
Right.
even understand they're forgetting things. So
Mm.
it is very easy to get overwhelmed. For example, even if I'm a person with dementia and I have to start my TV, I
Mm.
won't even know what the button on the remote means to switch it on, switch it off. And I can get overwhelmed. So what happens is a lot of catastrophic reactions is what we call when the
Mm.
person tries to compensate for the memory loss but just can't because the brain is just not supporting with any information. Apart from anxiety, there is psychosis where people with dementia might have frank visual hallucination, particularly
Mm.
also seen in the Parkinson's type of dementia or Lewy body dementia, what we call. So
Yes.
visual hallucinations might just be they might be seeing people in their room. They might be seeing insects. They might be seeing some vivid patterns or colors in the room, and this particularly happens in the evening time. During the daytime when the lighting is there, the person's brain interprets things properly, that oh, there isn't anybody sitting there, or my relative is there, there isn't any stranger. But in the night, the way the brain starts working also gives rise to a problem like this. In psychosis, another problematic issue, which is again complicated by memory loss, is delusion of theft, meaning they can't remember where they have kept their belongings
Mm.
and they feel that somebody has stolen it. And this
Mm.
is commonly, the person to unfortunately face. the Roth is the caregiver, is the closest family member.
Right.
Now, this is one thing, and another thing is they sometimes, they sometimes store their belongings away somewhere, like
Hmm.
knowingly that, oh, I feel this might be stolen, and then they forget where they have kept it, which again gives rise to more and more negative thought processes in them about who's taken it, but they
Right.
can't remember. Another one is depression. Now, understanding that I can't function so well, or my dependency has increased on my relatives, is not a good feeling for anyone to have. So there is a lot of depression that we see. Another symptoms are sleep issues. Now, senior citizens, to a certain extent, have been known to even abuse sedatives or hypnotics, the medicines that we call as benzodiazepines, because they have insufficient or the poor quality of sleep. The
Hmm.
next neuropsychiatric issue is agitation and aggression. Now, agitation can just mean that person is pacing around. Agitation
Hmm.
can just mean that they are opening all the drawers and just rummaging through it, seeing I don't know what, but they're just going through it. Other ways where they can be agitated is just they can grunt, wherein you feel that they are in pain, but they just it's like a sound that
Yes.
they keep on making.
Hmm.
In aggression, they might hit, they might spit, they might swear, they might threaten physical aggression. They might even behave sexually inappropriately with the female caregivers, and this is seen in male and female, both gender people with dementia.
Hmm.
There are vocalizations, meaning that they might say something repetitively. They
Hmm.
might
Hmm. Hmm.
make some noises once in a while, and again, this causes a lot of trouble. And the last in neuropsychiatric is personality changes. Again, they become a person with very poor judgment, so might become over familiar with strangers and can speak inappropriately, in social scenarios. So all of this together, all of the things that I discussed in this umbrella of cognitive impairment is seen in dementia along with the signs and symptoms.
Yes. Thank you so much. The examples have really helped us understand what all cognitive deficits are there. One thing you mentioned was the catastrophic reactions which happens. So, in that scenario, how should the caregivers behave, or what care they should take?
So, for any person, with dementia, there are certain strategies which we use to help the person with dementia, and I'll just in general, these are in general, and at the same time will include the catastrophization aspect of their behavior. Now, what I would advise the caregiver is to firstly have the person with dementia should have somebody constantly supervising them, not actively, but somebody in front of whom they are. Sometimes when family members are working and
Hmm.
it's a very early stage of dementia, I would have them install a CCTV camera in the home. There should be
Hmm.
family members or even hired help or caretakers, that can be there. It is necessary to have the person in a very quiet, decluttered room, because crowd or a lot of loud noises would cause a lot of behavioral triggers for aggression, for agitation in these patients. We have to, as a matter of fact, not change our environment very often. So sometimes when there are many caregivers taking but can't come to stay where the person with dementia lives, they get them to their place, and they find that once the senior citizen has moved into the new place, the memory, the behavior, all kind of becomes very confused. They become disoriented, is because the brain can't keep a track of the space around them. So it is
Right.
always advisable to have them in a very nicely lit up room, very quiet, and not of not lot of furniture in that room. Also,
Right.
the familiarity in the room is very necessary. Another thing that we need to do to prevent catastrophization is to have memorabilia in front of the senior citizens, wherein there are photographs, there are pictures, or something which they had really put value to. So these might be idols, religious books, or something like that, which they have had memories with, and where this can be a conversation starter also, कि
Yes.
दादा अब यहाँ गए थे तो वहां पे क्या क्या किया था. So there is a photo there. Can you just describe what you were doing there? and they kind of speak a lot about that. Generally, now to prevent catastrophization, another thing is because they'll be repetitive in asking. They'll not
Yes.
stop after one time. They'll just go and repetitively keep on asking instructions or answers. So if an answer or an instruction is given once, good enough, then it has to be written down somewhere. A whiteboard is preferable. So if ever
Mm.
he or she asks, we can just point, this,
Right.
this, so that we become a little bit calmer, and at the same time, whatever has to be communicated gets communicated to them. There are times when catastrophization also brings, or catastrophic, the thought processes even have aggression. So
Mm.
in a senior citizen getting aggressive, it is really necessary to keep them safe as well as keep ourselves safe.
Yes.
So necessary to have, maybe we can leave the room, or we can at least identify triggers in the past. If this person has gotten aggressive in some circumstance, then at least be alert that something like that has happened. There are medications which can be given for aggressive behavior. Of course, help can always be asked from the neighbors or other family members to protect. Now, people with dementia might also have what we call as wandering away behavior, meaning that
Mm.
they forget that they are actually staying with family. They forget that that's actually their house. But they might just say, Ki, I don't know where I'm staying, but I want to go back to my place. You guys are all nice and helping me out and feeding me, but this is not my place. My place is somewhere else, and I'm leaving for there. So talking more about preventing catastrophic reactions. So sometimes our senior citizens have wandering away behavior, and to prevent that, I would have the caregivers, ask the watchman to kind of restrain the person or not let them go out of the compound gate, or change the latch on the door from a very accessible horizontal place to a very vertical on the top of the door, so that the senior citizen can't reach there. It is also nice to have cards where the person's name is written, the phone number of a caregiver, and the address of that person is written. Because sometimes it just so happens that senior citizens are so quick to act that they might, leave the home and can wander away, and it becomes very difficult to keep a track onto them. But at all times, whatever they are wearing, there should be a pocket there where we can keep these cards, so that anybody who finds them can even redirect to where this person came from, or what their place was, to help them with less overwhelming thought processes during even taking medication, or
Mm.
following their regimen, having medicine boxes which have labels onto them, or supervising medications. Again, this is something which becomes very necessary, increasingly necessary through the stages of dementia, because sometimes senior citizens have a lot of medical ailments together with, alongside with dementia, like diabetes, hypertension,
Yes.
hypothyroidism, any arthritis, asthma. So there are medications which they are supposed to take, which are again very life saving. So
Mm.
supervising those medications, or having medicine boxes, or checking how many pills are left, can also help them with regards to their medical, the whole treatment aspect of it. Now we got to maintain hygiene routines for our patients. So they can't clip their nails or comb their hair, because again, this is an activity of daily living which might just get impaired in dementia. So even the clothing will have to be very practical. So whichever helps the person to maybe move properly, and at the same time, if at all we need any intervention, like taking a blood sample, helping them void urine or stools, so that practical aspect of clothing as opposed to the aesthetic has to be followed. So yeah, all of these kind of strategies are something which we really need to help our senior citizens with.
Definitely. Also, when a client comes to you, so what are the therapies or treatments we use as a mental health profession?
Right. So whenever I've seen um, any senior citizen being brought for treatment, there is what we call as a therapeutic nihilism. Meaning, why should we treat this person? They have been happy through their lives. Why do they need any medicines for their behavior or something like that? We know that this is a very normal, thought process, and aggression and everything was part of their behavior early on also. We just feel it's a worsening, and they feel they should not treat. And this is where it's a problem, where it's about the quality of life. And when we are talking about any treatments, it's about restoring the quality of life of the person with dementia, firstly. The
Right.
aims of treatment in dementia also change, wherein, firstly, we would maybe preserve the cognition which is there, which is whatever is left with in that person. But at the same time, sometimes it's also to reduce caregiver burden. Like I said, there are so many problems in behavior of the person with dementia
Mm.
that the caregiver can't help but feel anxious, angry, sad, all of these emotions while caring for them because of these behavioral issues. So the goal of treatment sometimes can be to just kind of slow down the cognitive deterioration, at the same time to kind of mitigate the behavioral abnormalities, so to say. But till date, there isn't any treatment which is available, any medication which can reverse the degenerative process of dementia, or there isn't anything which we have which can regenerate the neurons or the brain cells
Mm.
which have lost. There are times these days where earlier we had our doctors, we had books to tell us what was the authentic information. But these days we see a WhatsApp forward or a social media forward where somebody
Yeah.
claims, oh, this is a legendary therapy, new therapy which has come up and really helps everyone with memory issues, so should be given. I'll just mention few of them, which again have been very misleading. But from this video, and when people see this video, I hope they get this information about the right kind of treatments. So
Definitely.
the therapies which have no research backing them, but unfortunately, a lot of senior citizens are given these therapies now. Stem cell therapies, medications like piracetam, ginkgo biloba, acetyl L-carnitine, coenzyme Q10, omega-3 fatty acids, coconut oil, vitamin E, all of these things, or any herbal naturopathy, anything like that, where they claim
Mm.
that, oh, these things have no side effect, and I would say they might not even have an effect. So so these kind of therapies have no research backing them, and caregivers have to really understand that if there isn't any research, probably best not to expose the senior citizen to a medication. Again, there are a host of medications. There are medicine interactions. So we have to really limit and be very prudent with regards to what we are prescribing as doctors, and
Mm.
as the senior citizens caregiver, what we are having them do. Because again, many medicines can cause low blood pressure, can influence the blood glucose level, can cause
Mm.
disorientation. Now the medicines that we have in which any neurologist or any psychiatrist would prescribe for cognition, for kind of preventing the deterioration in cognition, are two types. One of them is called cholinesterase inhibitor. So these medication increase a chemical called as acetylcholine,
Mm.
which basically is required for normal functioning. Which these are the neurons which are actually shown to reduce in number, and this is mainly in Alzheimer type of dementia. Keeping in mind that Alzheimer's diagnosis is mostly after autopsy. So this is a very pathological, meaning we have to see that a brain under the microscope to call it Alzheimer's. Alzheimer's is a biopsy-based diagnosis, but in that, what we see is the acetylcholine neurons reduce. So, cholinesterase inhibitors, medicines like donepezil,
Mm.
rivastigmine, galantamine, these are medicines which are given to increase the acetylcholine level in the brain, and we can prevent at least or slow down the deterioration in the cognition of that person. The
Right.
other class of medicine is called NMDA receptor antagonist. Again, big name, but the medicine name is memantine. Again, helps with stopping, or rather, not stopping, but slowing down the progression of neurodegeneration. Then there are, as I said, the behavioral and psychological symptoms of dementia. The aggression, the depression, the anxiety, psychosis, sleep issues, all of these require some psychotropic medication, which we call antipsychotics or antidepressants. Now, when we treat a person with dementia, generally what we follow is that we start low and we go slow, meaning we start at a very low dose because
Mm.
the body of the senior citizen is different. The way they metabolize the medicines, the side effects that they experience at low dosage, these things are what we keep in mind, and we increase the dosage gradually. There are times now whenever we are giving medications for brain, if the brain has shrunk or if the
Mm.
cells are lesser, then the therapeutic effect will take some time to come into the picture. And sometimes caregivers are baffled that we are giving the medication, but why isn't the symptom relief happening? So all it requires is a little bit of patience, and gradually being in touch with their therapist definitely helps out. But yeah, these are the medical treatments that we have and the thought processes behind them in treatment of dementia.
Thank you so much for clearing the misconceptions around the therapies. One more question was that are there any lifestyle choices or habits that may help reduce the risk of developing dementia or any other memory
Right.
related issues?
So this is usually if I've had a talk at a place where there are a lot of senior citizens or their caregivers, even if sometimes these were weddings also where I have gone, and people have come that okay, I have parents who have had dementia, so is it genetic? Will I also have dementia as I age? No, these are changes. This is the phenomenon of neurodegeneration, and earlier when there were pandemics and infectious diseases,
Mm.
epidemics which used to happen, and people would not survive beyond the age of 30 to 40. So
Mm.
something like dementia was unheard of. Right now, with the life expectancy increasing, with our medications, with modern medicine, what we have seen is the signs and symptoms of neurodegeneration. So every one of us above the age of 65, if at all we have imaging studies, we will have some or the other manifestation, and there will be a sign and symptom of the neurodegeneration on a scan also. But there are certain things that a person can do to keep the memory going well and it properly very intact. Now, lifestyle modification may सबसे important modification that is required is the firstly the diet. Now, diet which is having a lot of vegetables,
Mm.
vegetables like broccoli, vegetables like cauliflower, which are very high in antioxidants, complex carbohydrates like sweet potatoes, people consuming whole grains, and specifically when the when the diet has low red meat, again, that is something which promotes good memory formation. Sometimes people make a mistake of only cooking in coconut oil, which is again, like I had mentioned, not very
Mm.
helpful dietary modification in preventing or stopping memory degeneration. Packaged foods, being away from packaged foods, again, very necessary. Cutting down alcohol, cutting down tobacco usage, very much important. Increasing usage of nicotine products or alcohol has been shown to be related to memory loss. Then
Mm.
managing ailments like diabetes mellitus, hypertension, uh, keeping the blood sugar in check, keeping the cholesterol and hypertension in check. Definitely. So what there is a caveat. What we call as if the heart, whatever is okay for the heart, should be okay for the brain as well. So managing your diabetes, hypertension, very necessary. Another thing, and this technique came from India. So yoga is a way of living, and yoga, meditation, exercise, very rarely used by people, but very effective. So anybody wanting the memory to get a bit better or stay better definitely has to go for these techniques, which were our in ancient Indian wisdom. The next strategy and something which is very helpful is socialization. Now, whenever we meet our friends, whenever we meet in a group, so I'm meeting a friend of mine. I asked him, oh, the last time we had met, you had mentioned something, that this was an issue with your life or with your family member. How is that right now? Meaning, I had registered something in the last session. I brought back that information into my consciousness, asked the question, registered the new information again. My friend
Mm-hmm.
also asked me, "Arey, you were talking about that thing. So where are you on that right now?" And then again, I have to, so the memory processes, encoding memory, retrieving information, all of that becomes a bit better. So socializing and that is where the beauty of Nana Nani Dada Dadi Park is really, really necessary. And it's very
Yes.
hard to appreciate that because people come to see and speak with each other. And it really helps in memory. Somehow the degeneration is not there. One mental health issue which has been shown to be associated with memory loss is depression. Now, depression is also called a pseudo dementia. Now, there are times where a person with depression would experience low mood, or they
Okay.
won't derive any pleasure from previously pleasurable activities. Usually, any person having these two things for 2 weeks can be diagnosed as depression. But depression, as a ailment, any person with depression would say that, okay, I have been having memory loss since the last 3 months, and I have difficulty in remembering things. As opposed to this, a person with dementia will not be able to say a clear or demarcate from which time period he has or she has been not being able to remember.
Mm-hmm.
This is one of the fundamental differences. A person with dementia would kind of undermine their memory loss. A person with depression would kind of say that, okay, the memory issues are very troublesome, problematic, something like that. Once we have a person taking treatment for depression, the memory issues just vanish. But it is not so in dementia. When we assess a person with dementia, they give a lot of in assessments for memory testing. A person with dementia gives a lot of approximate answers or gives wrong answers, wherein a person with depression would just say, "I don't know." that
Right.
that is that is something which they might not say. Person with depression again might have a high sense of guilt, wherein the person with dementia might just be very happy and very like ignorant and nothing like that. These people feel, I don't have any memory loss, you should test them, is what they would rather say, right?
Right.
um, right, so treating depression, again, a strategy which is very important in preventing depression. There are some treatable causes of dementia. So, hypothyroidism, hypoglycemia, diets which are low in vitamin D, vitamin B12, folic acid. So, having a person take these supplements, again, very helpful in maintaining the health of the brain cells. So, yeah, all of these are the lifestyle modifications. Anybody needing to kind of having their memory intact till a late life, this is something. These are
Yes,
steps which you should take. Right.
definitely. One more thing was, are there any resources available for these people who are suffering from dementia so that they can also help themselves?
Yeah. So I'll be sharing a few websites now. All the various subtypes of dementia, be it Alzheimer's, be it Lewy body dementia, Parkinson's disease dementia, all of them have websites. And one has to just put that in Google, and there will be non-profit organization or even WHO, has given out guidelines. So all of those are easily accessible on the internet. But I'll be sharing those websites and the details with you, so you can put it up on the website as well,
Definitely.
so that people can get proper guidance and information.
Yes, definitely. We'll share the links below this video as well so that people can have
Yeah.
access. Lastly, how has been your experience of treating these people or working with these people?
A person with dementia is a challenge. Now there is somehow there is a saying which we had, like, it takes a village to raise a child. I would also say that it takes up a whole huge village to even care for a person with dementia. Sometimes I would call the caregivers and tell them that certain basic things have to be followed while caring for a person with dementia. Number one of them is, so there are some 7 guidelines which I give them. Number one is respect that person. if they have some memory issues or behavioral problems, doesn't mean that they are not your parent or grandparent. Respect them as a person. Early or in the disease process, help them to be, very independent. But after some time, supervise. There should be no hounding. Like, what is my name? Where are we? Who we had met? That is to be done only by the psychiatrist or the neurologist. Family members should not do that, and the caregiver should also respect themselves and their limitations. Second, teamwork. So the ideal team to treat a person with dementia is a family physician who knows the person, and the person also has memory. Oh, that's my doctor, and that's not a person sent to harm me. So a family physician, dementia specialists like psychiatrists, a neurologist, an occupational therapist, neuropsychologist, who test for the dementia that is there, how much impairment and the severity of dementia. Family members, a lot of relatives should come together to help the person with dementia. And of course, there are certain times where caretakers might just be required to for supervision and help. Third guideline principle would be sticking with a routine. So routine for sleeping, meals, exercise, voiding stools and urine, all of this has to be followed. Four, the caregiver has to be prepared for hospitalization, for holidays, for trips, for any kind of health emergencies. Fifth one, flexibility. Now, flexibility is something which people, if at all the caregivers lack, then they are in for a lot of trouble. Wherein sometimes you got to go with the flow. Sometimes it's okay to let that person say wrong things if it's not hindering his safety or our safety. Let them have the argument. There are times where flexibility also requires us to distract that person, or to sometimes just say to them that, okay, you are right, give me 5 minutes, I'll just go and come back, wherein that person forgets the argument, and we kind of can get them to help whatever they needed. uh, the sixth one is positive engagement. So it is nicer to not argue or to criticize the person with dementia. I would rather have the caregiver show things how they are done, as opposed to giving them huge instructions. And at the same time, if they can't do anything, meaning activity wise or a task, then I would have the caregiver do the task in front of them, show them this is the way they're done, rather than speak it in details. I would also have caregivers reminisce about older things, because memory tracks really light up when we ask them to remember certain significant events in their life. And the last one is preserving safety and sanity. Now, imagine like a video game where the villain just gets stronger and stronger. No matter
Hmm.
how much you fight, the villain gets stronger. That is the kind of beast that we have in dementia. That no matter how much we try and fight it out, it still is a very difficult disease to handle, and a very high caregiver burden is there. So there are times where people with dementia would say, "No, would want to drive, or I would want to do these business decisions, or something like that." In
Hmm.
that moment, we write it on the prescription to the caregiver. Okay, so the caregiver can show a prescription saying, doctor has asked you to not drive, doctor has asked you to not do share market, or something like that. So,
Hmm.
and sanity, safety and sanity is also for the caregiver, because again, a lot of caregiver burden is there in a supporting a person with dementia.
Definitely. I guess a
Yeah,
caregiver's role is very important. It's not just taking care of that particular person, but as well as maintaining their own mental health throughout this. So it's very
yeah.
important, and you've shared a very important points that they can do and apply in their daily life. So thank you so much, sir. And also today is World Mental Health Day. So what message would you like to give to our audience?
So, I would like to wish them a very happy World Mental Health Day. And there is no health without mental health. Mental health matters. Remember that your brain is the master controller of your body. So if the brain is healthy, happy, rested, calmer, then all the aspects of your life are very peaceful. At the same time, if the mind is functioning very well, then you can definitely achieve your potential. So yeah, my wishes on World Mental Health Day to everyone who's listening.
Thank you so much, sir. And definitely, you have taken us through a journey of dementia, right? From clearing the misconceptions, giving us more information about the domains. So, it has been really helpful, and people are definitely going to love this video. And there are a lot of takeaways basically. The way you were giving examples, it was more relatable, and people will be able to follow these guidelines when working with a person who is suffering from dementia. So thank you so much for taking out time and giving us such a valuable information. Thank you so much, and also wish you a very happy World Mental Health Day.
Thank you. I wish you the same. Thank you for having me.
Thank you, sir.